Having the patients see things around them that they haven't seen before, to share those moments with them is a lot of fun.
I love being an ophthalmologist. I have the ability to help patients rejuvenate their vision, and I can make a difference in their world.
It's not just giving patients better vision, it's really impacting how they see life.
LASIK should have been done sooner because it makes such a big difference in your day-to-day life. And if you have the opportunity to get it done sooner, it's totally worth it.
And then after you have the cataract surgery, then you're like, wow, this is what I was missing out on.
So with EVO ICL, I got the option to, even if my prescription changes in a couple years, I can take it out and put it back in. It's something that I would definitely recommend.
What makes me most proud to be part of Coastal Vision is the fact that Coastal Vision really prioritizes high quality, consistent outcomes and has access to all of the best technology.
We're going to take into consideration lifestyle, visual demands, hobbies, how patients use their eyes in order to give them the best vision possible.
I think Coastal Vision has been a really positive experience, and I definitely would never go anywhere else. I would tell everyone to come here because the doctors are just so amazing.
I can't speak highly enough about them. I still keep the brochures at my desk, and if they come over, I go, hey, you gotta look at this.
Thank you so much, everybody. My life is forever changed. Thank you, thank you, thank you.
You've decided to have a vision correction procedure to help you see clearly without dependency on contacts or eyeglasses. But where should you begin? This video will explain the options currently available to help you decide with your eye doctor which one might be best for you. In order to see clearly, the eye must focus incoming light onto the retina at the back of the eye. If light does not focus on the retina, the eye may be nearsighted, farsighted, and/or have astigmatism. There are several vision correction solutions that help refocus the light, enabling the eye to see clearly. Glasses or contact lenses have traditionally been used to achieve clear vision, but today there are other permanent vision correction options available. A doctor may use a laser to correct your vision with procedures called LASIK, PRK, or SMILE. Or the doctor may use the EVO ICL technology to correct your vision through the addition of a lens. Here is a brief description of each procedure. LASIK surgery begins with anesthetic drops applied to numb the eye. Next, the doctor will use an automated device to create a thin flap of tissue on the cornea, the clear front window of the eye. The doctor will then lift this flap and hinge it back, out of the way. Then, the doctor will align the laser beam with the eye and supply laser light pulses to remove tissue and permanently reshape the cornea. The laser will be programmed with the information gathered in the preoperative exam. Finally, the surgeon will reposition the flap, smooth it with a medical sponge, and allow it to dry for a short time. With LASIK, clear vision can be achieved, and recovery usually occurs quickly. PRK is similar to LASIK and also corrects vision by reshaping the cornea using a laser. First, anesthetic eye drops will be used to numb the eye. Next, rather than creating a flap, the surgeon will remove the epithelium, which is the thin layer of protective cells that covers the cornea. Then, as with LASIK, pulses of laser light will be delivered to reshape the cornea. With PRK, excellent vision can be achieved. However, recovery takes more time, generally 2 to 3 weeks due to healing of the cornea surface cells. With both LASIK and PRK, nearsightedness, farsightedness, and astigmatism can be corrected. LASIK and PRK may not be ideal for people with high levels of nearsightedness or those with irregular corneas or dry eye concerns. SMILE is another laser vision correction procedure that permanently reshapes the cornea. During the SMILE procedure, lasers separate a disc-shaped piece of corneal tissue from itself. The disc is then removed by the surgeon through a small incision. With SMILE, nearsightedness and astigmatism can be corrected to achieve clear vision, and recovery usually occurs quickly. Instead of removing corneal tissue with a laser to reshape the cornea, the EVO ICL is an additive lens-based technology that delivers sharp, clear vision both day and night. First, anesthetic eye drops will be used to numb the eye. Next, a tiny opening is made in the cornea, and the EVO ICL is folded and placed in the eye. The lens naturally unfolds, and the doctor will tuck the edges of the lens behind the iris. With the EVO ICL, patients experience a quick recovery and have the added peace of mind that the lens can be removed at any time by a doctor. Unlike a contact lens, there is no maintenance needed, and once in place, patients cannot see or feel the EVO ICL lens. EVO is for patients who have nearsightedness with or without astigmatism, and may be an option for patients that have been told they are not candidates for laser vision correction. LASIK, PRK, SMILE, and the EVO ICL procedure can each provide excellent visual results, and overall, these vision correction procedures are typically quick and painless. Laser vision correction procedures are permanent. While the EVO ICL is designed to be permanent, it can be removed or replaced by a doctor if needed. Thank you for taking the time to review your vision correction options. LASIK, PRK, SMILE, and the EVO ICL procedure offer unique advantages for patients wanting to eliminate or reduce their dependence on glasses and contact lenses. Your doctor will explain the risks and benefits of each procedure to help determine which one may be best for you.